Okay, so hi everyone. Thank you for joining tonight. We have a really awesome panel, and before we get started, I'm just going to do some quick introductions about what Global Surgery Student Alliance is, as well as some awesome opportunities coming up. So real quick, I'm going to just exit out of here. Can you guys still see everything?
Mhm.
Okay, perfect. So, just to introduce Global Surgery Student Alliance, we are an organization that's under an international global surgery organization called Incision, and the US chapter is called Global Surgery Student Alliance. We have chapters all over the country, and a really cool opportunity coming up is the 2025 National Conference at Harvard. The Harvard Medical School and Dental School is combining to do a conference that the theme is building resilient surgical systems for forcibly displaced populations, which is very relevant to today's panel as well. And you can online register in person, or you can do like online registration. So if it's too challenging to get to Harvard, you can always just Zoom in. And I believe that it is free as well. Submitting abstract deadline, unfortunately, is closed. However, you can look at the schedule and there's some really awesome speakers coming up. So just wanted to give a quick plug in. There's amazing keynote speakers. There's a theme called disasters and crisis response. There's even a patient's perspective with patients who were evacuated from Gaza and are currently being treated at Harvard Hospital. So really cool event. I encourage you guys to check it out. And if you guys want more information, you can just Google Global Surgery Student Alliance or look at our link tree where you can find a bunch of our relevant links. So with that said, I'm going to go ahead and stop sharing and transition to Munther. The schedule for today is basically just introduce our docs, get to know more about their story, and then we'll start asking questions. First, we're going to go off of the questions that were pre-sent through our form, and then we'll open up the floor for any questions that you guys might have. All right.
All right. Hello, everyone. Today I have the pleasure and the honor to introduce two speakers. One of them is here. One of them we're still waiting on, but we'll go ahead and get started with Dr. Jawad Khan. He is an orthopedic surgeon in Southern California who specializes in hand and upper extremity surgery. Correct me if I'm wrong, April, you were in Gaza for about 4 weeks, is that correct?
More 2 weeks.
2 weeks. Two
Yeah.
weeks, and in that time he was operating, and I will honestly just pass it on to you if you want to get started, and tell us a little bit about that experience.
Yeah, sure. So, like you said, hi everybody. Thanks for having me. My name is Jawad Khan. I'm an orthopedic surgeon, fellowship training in hand surgery. Graduated from fellowship in 2018, and have been in Southern California since. Um, I've when I was in med school, this journey and going to Gaza, started back then, in the sense that, when I was in med school, I knew I wanted to do like international medicine, specifically things like this, like going to conflict zones. A lot of the mentorship and guidance I had was always kind of pushing towards surgical subspecialties. You know, those subspecialties are rare and hard to find in the third world, especially in places like Gaza and Palestine. And even if they are there, they have very limited access to them. So that really kind of pushed me towards orthopedics, and then hand surgery in particular. Um, I've actually gone to the West Bank twice. I'm sure you guys have heard of Palestinian Children Relief Fund. I went with them in 2011 and then again in 2017. So I had some exposures to the Palestinian conflict. It was definitely a very different experience because it was not an active war zone at that time. So, when the October 7th and the subsequent genocide started, I think I was like most people, and that in the sense that we felt helpless and, what can we do to help? And you kind of felt like there was really nothing you could do besides protest. But, was very lucky in the sense that an organization called Humanity Auxilium, and I always like to plug them just because they're a great organization. They're based out of Canada. They actually reached out to me in January, and this is January of 2024. So October 7th, 2023 is when I think everything started. You know, November, December goes by. We're all just seeing these like horrifying scenes from Gaza, just feeling helpless. And then in January, I got a message from one of the coordinators saying that they needed a hand surgeon because they were sending a team into Gaza. And I was shocked that they could do that because, you know, the 2 times I went to the West Bank before, I was always kind of just like, hey, can we go to Gaza? And it was always just like, no way, it's impossible. Can't do it. It's very, very hard. So I was pretty shocked to hear that we could go to Gaza during this time. So when they asked if I was interested in going, I was just like, absolutely. You know, there's no way I would turn down an opportunity like this. So that was in January, February. It took months of getting like approval from the Israelis, the Egyptians, the Palestinians. And then I got accepted, and we were able to go in April of 2024. So I was basically there from like April 1st to April 12th. So it was, you know, a little less than 2 weeks. The trips that they were doing and organizing back then were 2-week trips. So that was kind of the opportunity that was offered for us. For me, it was awesome in the sense that I got to go there during Ramadan, and this was Ramadan of 2024, and I was actually there in the last 10 nights of Ramadan. So, you know, I know not everyone is Muslim or everyone here is fasting, but, you know, the last 10 nights are actually very special. It's a very special time for Muslims during Ramadan. So being there during that time was just an amazing experience. But so, you know, I got approved for the trip. We had to fly into Cairo. Remember, you know, now the Rafah is controlled by the Israelis. So when I went, the Egyptians were controlling it. So it was much easier to get in, and there was no restrictions on what we could take in. You know, basically, you know, you could take in anything besides medications, which is, you know, that comes from the Egyptian side. They want you to take their medications in, but we took like 8 luggages with us, took tons of cash, and landed in Cairo. The next morning, we headed to the border. And I always like to tell people, you start to see, you know, what's going on like hours before you even get to the Gaza border, because you're just seeing like miles and miles of like semi trucks full of like, you know, equipment and medical supplies and things like that, humanitarian aid, that are just parked on the side of the highways because they're not getting inside of Gaza. So even before you get to Gaza, you're starting to see what's happening in Gaza and some of the things that the Israelis are doing to make like life difficult in Gaza. We got to the Rafah crossing, have to go through the Egyptians and then the Palestinians to get in. And then once you're inside, the minute you cross over the Palestinian side, you see the sign, you know, I love Gaza. You start to hear the drones. And then for the next 2 weeks, that drone sound was just there continuously, you know, it became like a white noise in the background. So we were at the border, and you know, we had a lot of supplies to pack and unpack. And they kept telling us, you know, make sure you leave soon. Don't drive at night. Don't drive at night. And unfortunately, and of course, we had to drive at night because everything took too long. So we got everyone had their assignments. So some people were going to European hospital, but a few of us chose to go to Shuhada al-Aqsa, which is a hospital in basically like central Gaza, Deir al-Balah, because they said there was actually more of a pressing need there, but it just was closer to the conflict zone, and that line the Israelis were controlling in the north. So we chose to go there. We drove there at night, and you know, that first night it was really dark out. There's no lights anywhere, so you couldn't really see the destruction until the next morning. But you know, that's kind of when we really first started to feel a little bit unsafe. You know, in the sense that you know, when you travel overseas, you go to these areas, sometimes you kind of get comfortable. You think, like, hey, I'm an American citizen. Like, what are they going to do to me? They're not going to do anything. But I'm sure you guys remember the World Health Kitchen. You know, those guys were actually in line with us at the crossing. So I remember seeing them, very, very vivid memory of them walking around with their carton of eggs. And we kind of just laughed, like, you know, what are these guys doing? And you know, had a little conversation with you know, amongst people saying, oh, they're with the World Health Kitchen, so they basically are just bringing in food. And then lo and behold, the next morning, we find out that they were killed. And actually they were brought to our hospital, but they were brought in the middle of the night while we were sleeping after we arrived. So we got to there. We got to the hospital. Immediately, the hospital complex, you see, it's basically like a little mini city, tents everywhere, people living everywhere. Every inch and every foot of that hospital complex, inside and outside, was had someone there, basically living there. They'd set up their own little tent and basically live in the courtyard of the hospital or inside the buildings. So you kind of immediately saw that people were looking for safe places, and a hospital should be a safe zone, but obviously we know that's not really the case in Gaza. And then the first night there, we met a lot of the hospital administration. This was almost a year ago, and I can only imagine how much worse things are for the people there. When we were there over almost a year ago, everyone there had lost somebody. Everyone there had been affected. Even the director of the hospital, we were sitting there in a meeting when we first arrived. They were just welcoming all of us, and everyone just kind of noticed he was sitting a little funny. It turns out, like, literally a week before, his house had been bombed, and his wife and 2 children were killed. And from the explosion, he was actually thrown against the wall and fractured his spine. But I mean, here he was, a week later at the hospital, still working. And that's something we saw, with everybody. I mean, everybody, like I said, everybody had loss. People had injuries. They had significant weight loss. All the doctors would jokingly show us pictures of themselves, from months before, and just showing how much weight they lost just because of the lack of food. But all these guys, all these physicians, all the healthcare workers and nurses, social workers, therapists, everyone was working since October 7th, and no one was getting paid. So these guys are basically just serving their people, and they just knew that despite not being paid, they had essentially had a duty to their people. The next day is when everything really started for us. I remember my first patient. It was an 8-year-old girl. She was shot in the arm by one of those Israeli quadcopters, those drones. And that I feel like that case is always is one I always bring up, because I think a lot of times people, they write off these deaths and these injuries as collateral damage. Oh, they were next to some resistance fighter in some building, and that's why they got hurt. But this girl and her 3 sisters, so 4 sisters total. One unfortunately passed away. All 4 were shot. One was shot in the arm. She was my patient. And then 2 were shot in the legs. So one had a femur fracture that was fixed, and one actually had a fracture, but also had an injury to her femoral artery that fortunately our team brought a vascular surgeon, so he was able to reconstruct it. My patient, got shot right below her shoulder. And I mean, I can't even describe how, just the zone of injury, and get a really good sense of what type of caliber bullet they're using. I own firearms. I have a 9mm handgun. I've treated gunshot wounds before in Detroit. They're when you look at those entry exit wounds, I mean, they're generally and relatively they're clean. But this looked like an arm, like a bomb exploded in her arm, and unfortunately there was no saving her arm. So we had to do an above elbow amputation for her. She was 8 years old. One of the biggest issues with the healthcare there is patients get lost to follow up. So, we treated her, and then for the rest of the time there, I had no idea how she did. But what's really what was beautiful is when I came back a couple weeks later, Khalid Beydoun, he's this guy in social media. He actually posted a picture of her. It was a picture of her smiling, and she had a dressing on her arm, and was actually still wearing the same clothes from the day of the surgery. And that's just kind of that's a good kind of snapshot of all the patients we were seeing. I don't have official statistics, but I would say roughly about 75% of the patients I saw were children. They were majority gunshot wounds. So, like I said, this argument that it's collateral damage is null. And obviously, I'm orthopedics, so I'm treating extremities. And because they didn't have a hand surgeon, they kind of were always pushing the hand cases to me. So, I would help out with like leg injuries and things like that. But most of what I was doing is hand. And most of what I was doing was gunshot wounds to the arms. And when I would help with the leg cases, they were same thing, gunshot wounds to the legs. So um, um, just a good, good representation of the type of patients we're seeing, what else? Can you close the door, Jenna? Oh, sorry. When it comes to like how we were treating the patients, even I had to be reminded, like, that we're in a war zone. I saw patients and I said, okay, this patient needs a tendon transfer. And they were just like, no, like, doctor, we're at war. We have to save those type of cases for later. So everything we were doing was basically stabilizing or amputations. Unfortunately, amputations was like the bulk of what we were doing because we just didn't have the resources, the time, and sometimes they didn't have the equipment needed to do like nerve repairs. So in that setting, sometimes the right thing for the patient to do was to perform an amputation, because that was the quickest recovery. And because worst case scenario, you try to do some big reconstruction, they get an infection. And the infection rate there is astronomical. I mean, more than 50% of patients there are getting infected. So these are the kind of things you have to think about, So if there's a ton of patients I saw there that, I thought to myself, if I was in California, we would save this finger or we would save this arm, because we had the right equipment. I had the right staff. And I didn't have to worry about like flies in the OR, like landing on the wound. And you see that happen and you're just like, oh God, this patient's going to get infected. You just don't have to worry about things like that, So the worst thing you could do is try to fix someone's arm, put a metal implant in there, and then the metal gets infected, and then there's really nothing else to do besides another surgery to take that metal out and possibly amputate. So, we had to really, you had to really triage things and treat things appropriately for that setting. Um, going back to the infections, they had one room running all day long just for washing out infections. That's just how big of an issue it was. Infections were everywhere. And that's, one that goes back to the sanitation. The Israelis have destroyed their sanitation infrastructure. So there's flies and mosquitoes everywhere. And that's a problem they said they did not have before, where there's just flies in the OR, flies in the hospital. And then also the patients are just malnourished. When we were there, obviously we were fasting for Ramadan, so it was a little easier for us to adjust. But you can see that these the patients were, even when it was time to break their fast, they had mainly rice or bread. A couple days after we got there, they actually started getting access to chicken, but we kind of made it a point. We're saying we're not going to eat any of the chicken while we're here. These people haven't eaten this stuff in months. Eventually they forced us to, because that's just how they are. But you just imagine the malnutrition, the lack of sanitation. All these things just lead to just a very, very high infection rate and a very large burden on their healthcare and society. So there were no elective cases done. There were some patients I was seeing where there were things I knew I could do for them, but unfortunately they had to be pushed off till after the war. And that's just because they need the surgeons. They don't want them preoccupied with elective cases. They need the OR rooms, they need the staff, they need the equipment. So it's a very different mentality when you're going in there, treating patients in that setting. What else? The post-op care is basically non-existent there. You do surgery on a patient and then you basically never see them again unless they have an issue. And unfortunately, you might not even know if they have an issue because they might end up with some other doctor and some other doctor will treat them. Pain control was a huge issue. You can imagine, when we were there, we basically we lived in the hospital. We weren't allowed to leave the hospital. The idea was the Israelis know you're in the hospital. Don't leave the hospital. Don't change any plans. You being in the hospital keeps everybody safe. That's something that they all they kind of emphasized to us that they always wanted doctors there, not because they don't know what they're doing. The doctors they have there are brilliant. They are overworked and they're tired, and they do need help and support. But they want us there because, you know, foreigners being there actually brings safety to the hospital setting. You know, they're less likely to attack a hospital or bomb a hospital if a bunch of Americans, Europeans are there. Um, so yeah, I mean, there's still a lot of ongoing issues. Like I said, the post-op pain control is an issue. We lived in the hospital, and you know, sleeping at night. I mean, you can just hear people screaming throughout the hallways just because they're writhing in pain, and that's because we had to amputate above their knee, and all we have to give them is Tylenol. So you can imagine it's a very different experience than what we have with training here. You know, I know you guys in University of Washington, especially the residency programs. I mean, you guys are like a major trauma center. So you know, you guys see trauma, but then there's this other type of trauma that you're just not going to be exposed to unless you're in an active war zone. Um, so yeah, I mean, I guess now would be a time to, if you guys are, unless Dr. Hamawi's here, I'm okay to start with questions if you guys want.
Yeah, I was gonna just read some questions off of that some of the students submitted, and then if anyone has some follow-ups, we can do that as well. But one thing that I wanted to ask, and someone mentioned, is, and I've heard this from other doctors who've gone to Gaza, is that are there any techniques or skills that local Palestinian health professionals taught you that you have brought home to your own practice, and also like things there that like you've had to adapt that they taught you, like, oh, you know, like similar to what you mentioned, where you want to do something a way that you would do it here, and they're like, no, this is how we do it here, and you know, things that worked for them that you had to adapt to.
You know, there really wasn't a lot of that, only because when it came to hand stuff, they were all general orthopedic surgeons, so they were deferring to me for a lot of things. Um, and then, like I said, you know, like the majority of what we were doing was, you know, amputations and fixing fractures. You know, and you know, fixing fractures, the technique is the same. You know, they learn the same things we do, and then putting on X fixes. So I don't know if you guys know what an X fix is, but it's basically, you know, you do that in the setting of like very severe trauma where like the soft tissues are just extremely damaged, and you don't want to make an incision on it to fix a bone because you're worried that you're going to compromise the blood supply and things like that. So what they'll do is they'll put like these rods on the outside, connect them with other rods, and just provides like a nice stable construct for a bone to heal. Um, so they do a lot of that there, and then they do a lot of that there because they're dealing with a lot of like very extreme like trauma, you know, like extensive soft tissue injuries. Um, they're doing it for that reason, but they're also doing it because of the fact that they don't have the other things. They don't have the plates and they don't have the screws, and if they do, they don't have the right sizes. So these X fixes, you know, we don't do a lot of those here in the U.S. And so, you know, seeing how they did some was definitely a learning experience. You know, they're very creative in the sense that they're reusing a lot of the X fixes, and they're minimizing the amount of rods they use because they know they need to save them for other patients. But you know, overall, I mean, as brilliant as they are, and I mean, those guys are better surgeons than we are here, hands down. You know, we were doing very just like classic procedures when it came to amputations and fixing fractures. I can't say that there was something different that they were doing that we don't do here. But I can tell you that they were doing a lot more of the X fixes, but I think that was a lot more due to the circumstance.
Yeah, and kind of tapping onto that, you were talking about like the limitation of like the rods and the screws and things like that. And then you mentioned also that a lot of these procedures were done just with Tylenol, and so what were the things that were very different in terms of limitations and supplies? You know, I've heard on the news that, you know, a lot of these amputations were done with little to no anesthesia, and what were things like that that were really different and that you felt you need to be conservative with, and that were just completely different than your normal practice?
Yeah. So, I mean, if I fix a fracture here in the US, like just say like a distal radius fracture, like a wrist fracture, I mean, you fix it, you get this very specific plate for distal radius. It's like contoured to the bone. It's very anatomic. And we have everything we need here. If they're missing a screw size, like we get upset and get annoyed and yell at them. But over there, I mean, you're just dealing with very basic, very simple plates and screws. A lot of times they're like too big to put in, but you kind of have to use them anyway. So you're using adult size plates and screws on kids because it's just what you have. Um, so I mean, in terms of like the limitations, like I mean, you can imagine, this is like I said, back then it was a few months. Now it's been over a year. Back then they were short on supplies because they were just running out of plates and screws to put in people. Um, so it's definitely a major issue. But kind of going back to the X-Fix thing is, th- we were literally seeing like families pass down X-Fixes like to them, like to other family members. So they get a fracture, we fix it with an X-Fix. Eventually you take them off like 6 to 8 weeks later, and then they were just demand that they keep them. And what are you going to do? Tell them no? So a lot of times they would keep them because they're going to pass them on to family members who have other fractures that they know need to get fixed. So the lack of resources there is a huge problem. And when we went, we were able to bring in supplies. So I brought in some plates and screws and things like that. But we also had no limitation on luggages. Now that the Israelis control the crossing, they you're allowed to bring one luggage in. You also have to commit to 4 weeks. You have to stay inside Gaza for 4 weeks, and you're allowed to bring one luggage in. So you can imagine, packing for yourself and trying to bring supplies, impossible. And that's on purpose. They're also limiting the amount of cash you can bring in, things like that. So they're making the lack of resources like a bigger problem. When it comes to anesthesia, yeah, for sure. They're luckily for me, we can do procedures without general anesthesia. We found this thing called a butterfly ultrasound, and we bought a bunch of them. It's basically like an iPad you can buy, and you connect this. Have you seen those or?
Yeah, we actually get to use them during our curriculum. They let us practice with those. So yeah, it's very cool.
We took those to Gaza, and they were like, this is the best gift we've ever gotten ever. And because then they were able to start doing like regional blocks. They can use the lidocaine they have and just numb up an entire arm, so they didn't have to waste the anesthesia for those cases. So definitely different, but just they're just very creative, and they can accommodate and adapt to any situation.
Yeah, that's incredible, and I'm sure, yeah, I can't imagine what it's like. We did have some questions about training. So
Yeah.
as with us being trainees and in our education, a lot of questions were around the gist of, what can we do to train? What are things that you've done or that you would recommend that we do in our training to prepare us to go into these places, go, across the globe. And yeah, and my twist on that and what I want to add is, I've seen on social media there's a bunch of trainees in Gaza, Palestinian trainees. I don't know if you had a chance to work with some of them, but how do you feel like their experience was, or like what they are going through and how their training is affected? And we at our school we're actually trying to bring students from Gaza to on scholarship to our school. So things like that where it's like training related, anything that you can add.
Yeah. So, in terms of like training, I'm a big advocate of the surgical subspecialty. So, I mean, starting from, you guys are all med students. So starting from just picking which subspecialty or which specialty you want, when it comes to these things overseas, like disasters and war zones and conflict zones, what I've noticed is what they're always looking for is they're always looking for orthopedics, looking for ENT, plastics, and general surgery trauma, and ER docs and ICU docs. So those are like the six big ones that I felt like they really needed there. And that's not to say other specialties can't come. My team that went, we had a family medicine person and internal medicine person, but they were thrown into the ER. So they had to adapt, and they learned a lot while they were there. But if you really want to be prepared for it, I think you need to choose the right specialty, especially if you want to go overseas for these reasons. And you should also probably look at a specialty or like a training location that, that has a lot of trauma, like say for orthopedics. I mean, if you go to like UW, I mean, everyone knows that's like where you go for like trauma, for orthopedic trauma. Whereas you could pick a residency that's maybe light on trauma, but like does a lot of like sports and joints and things like that. You'll get some trauma experience, but I can guarantee you someone coming out of like UW orthopedics, especially trauma, is going to kind of feel just at home, not just at home, but they're going to feel very comfortable and be able to adapt very well in a setting like Gaza. Aside from that, like, the first time I went on a medical mission, I was actually a resident. So I was a resident, third-year resident. And then again, I went as a fellow. So you can even go during your training to get exposure to these things. But at the end of the day, it's a lot of it is just kind of being thrown in there and just kind of like learning as you go. I think the point of residency is to just get you comfortable, with the anatomy and the pathophysiology. So if you do get put in one of those positions, you can kind of just sit back, just rely on your training and your education and your ABCDs, and just kind of just do what you need to do. Like I said, when I was there, like there were a lot of things. Like I haven't fixed like a tibia fracture in probably like a decade now, but while I was there, they were just like, we need your help fixing a tibia fracture. I was like, okay, let's do it, and things will kick in, you'll remember things. And I mean, you do your best, but I think if this is like a big part of what you want to do, you have to start like, now in terms of like picking where you're training for residency, fellowship, just so you can be comfortable dealing with like, high level trauma. And then what was your second part of your question again?
I was actually just going to open it up to the rest of the students if they have any questions to ask you, and for anyone you can just unmute or raise your hand or send it in the chat, and I'm happy to read it off.
Hi, I have a question.
Hey, what's up?
First of all, Assalamu alaikum, and thank you very much, Dr. Jawad, for doing this and being here. My first question is, like, as med students, what can we do in our capacity as med students right now to kind of help out with Palestine and Gaza in general? I think either over here or other mission trips that we can go on right now as well, or
Yeah.
I guess those are the questions I have.
Yeah, no, I know some of these organizations are taking med students, so, I mean, if you can get on a trip, go there. I would absolutely recommend it, but just know that you're, there's some danger to it. But, there was a point where they were telling me that I like they might not need me because there might be another hand surgeon, and I was like, I don't care, like get me to Gaza, I'll clean bathrooms, like just get me there so I could physically help them somehow. Um, so there's organizations like Humanity Auxilium, I think Fudger Scientific. They do have information on their website for pre-med students and med students to go. So I think those opportunities are there. In terms of what to do here, I mean, it's tough to say, especially seeing like these recent crackdowns again on the protests and stuff. I mean, it's hard for me to say, or for me to tell like young people like, hey, you need to go protest. But I think that the response to it shows it's working, and it scares them. But I know it's getting tricky now because they're talking about like deporting people and arresting them and things like that for protesting. But there's always something you can do. I mean, whether it's just keeping them in your prayers or just just talking about them. When we left there, everybody, like before we left, was just like they all just kind of the same thing, is like, please just like don't forget us and just tell everybody what you saw. So even if you haven't gone, you see what's happening there. It's all on social media. Just got to keep talking to people. I mean, people will, you'll deal with the people calling you liars. I had people messaging me on Instagram telling me I was lying about what I saw, and I was just like, man, like if you can't even believe like someone who was physically there and saw, with his own eyes, like, there's no helping that. But yeah, there's always something to do, even if it's small and minute, you know.
Just a quick follow-up. Thank you, first of all. And then I noticed your hoodie looks pretty nice. Where'd you get that from? Any idea?
Oh, yeah, God, what's it? It's called I'll remember it.
Okay.
I'll remember it before the end of this talk.
Okay.
Yeah,
Sounds good. Thank you.
no problem.
Hi, Ramadan Mubarak, and thank you for taking the time to talk with us today. This was very haunting, but very powerful and moving as well. I was wondering, have you been able to keep in touch with any of the patients you operated on or any of the other doctors or healthcare providers you worked with?
Yeah, that's a great question. So not necessarily patients, just because you know, like I said, the follow up of the patients was basically non-existent. But I'm still talking almost every day to people I met there. Um, when we were there, we got room next to this guy, Sheikh Abdullah, and we were just really lucky because he was leading Tarawih every night, and we were praying Tahajjud with him every night. So I still text him every day. And there's other families that were there that I met that I still talk to. Um, and we text every now and then, and it's just by my conversations with them, I feel like things are getting worse, because there's people who never asked me for help, and now they're saying, hey, like we really need some help. I feel bad asking you, but I think with this new block on humanitarian aid, I think they're already feeling it, um, so yeah, I mean, I'm still talking to them. Alhamdulillah, they still have access to internet and being able to like communicate. But yeah, I mean, unfortunately, it seems like things are getting a little worse there. So, um, but yeah, we're still in touch.
Hi, thank you so much for sharing your experience. I was curious about like the setup of the hospitals there in terms of like, were you still the go-to person for any like extremities trauma, or was it kind of just like who's on board? Or yeah, I've just been reading a lot about like local physicians who are not specialized in like trauma or ER, but they get thrown into the ER and you kind of, as you said, you have to quickly adapt, but like, what does that look like in reality?
Yeah, so for me, they basically just kept me in the OR. So, there's part of the team was just went straight to the ER, and then we were just basically in the OR every day. But being a hand surgeon, basically someone would just randomly find me and say, "Hey, we have a patient for you," and I'd go with them to the ER or go to them to the hospital floor and find them. But, I mean, things were coming in, and they knew where I stayed, so they knew where to find me. It was very chaotic in the sense that it was like kind of like organized chaos. Like, they had a start time for their OR, and they basically did cases all day, all night. But it was kind of unorganized in the sense that, like, I'd have one case here, one case there, help with someone here, So, and every day it was a different surgeon. So they had their own little system, they had a little system. There were actually a lot of orthopedics there because their other hospitals had been destroyed and things like that. So they had people. It's just they all were overworked and just basically just tired, fatigued. So we kind of were just like support there, and giving them a little relief. But I mean, the only way I can, or like this, it was just like kind of like organized chaos. It's just, I mean, you walk into the ER, like, I mean, you're just getting stopped by patients, by doctors. So it was very hard to keep track of patients in that way. I mean, there was a patient, and man, I still like feel bad to this day about this. He got shot in the arm, he had a tendon injury, and they came and saw me, and I was like, okay, let's book this for surgery. And then I never ever heard anything about him ever again. And like I would ask, like, hey, where's that guy? And they're like, we don't know, we'll find him for you. And I was like, the next day, where's that guy? Where's that guy? So that was kind of like how the 2 weeks was. Like every day we just kind of woke up and had no idea what was going to happen that day.
I have another question.
By the way, everythingpalestine.org.
Okay, cool. Thank you. Thank you. All right, I'll remember that. Thank you. So first question, and if we have time, I can do a second one. But I know being in Palestine and Gaza and seeing all that, you know, I feel kind of can affect you. How was like being there? Like, how did it affect you, like emotionally, mentally, spiritually, and then how did it affect you, kind of like being out of that now?
You know, when we left, I mean, we immediately felt like we felt the guilt of leaving like right away, you know. As soon as we got to the airport, um, and then we were sitting there talking, and then we all just kind of looked at each other and we're like, we looked at like all the food we had on our table and we're like, man, like we literally just left and look at we already have all this food in front of us, you know. And subhanallah, like while I was at the airport, I was getting texts from one of the kids I met there, and he was asking me if I could take pictures of an airport because he's never seen an airport before, and if I could take pictures of airplanes because he's never seen the inside of an airplane before. And you know, so like right away when we were leaving, we were just like, man, this is, you know, like you just had this like survivor's guilt, um, and we immediately all wanted to kind of go back, you know. Subhanallah, me getting back has been very hard. Like I've been having a hard time like finding an organization to take me, which is really weird. Um, but in terms of like how it affected me, you know, when I was there, I feel like I deal with things differently. You know, my friend who went with me, my friend Omar Sabha, he's an OR nurse. He came with us on the trip. I mean, you know, he had a hard time. You know, he was crying every night. You know, it was very emotional for him. Um, Me, you know, like prior to that trip, I can't even remember the last time I cried. You know, but you know, I think based on my training and things like that, you know, I've seen a lot of death with the training I've done. My residency was in Detroit, and my med school was in Detroit. I worked in a morgue. You know, I did autopsies on people who were shot and killed and things like that. So I don't know if in some sense I was like desensitized to it, but um, I didn't have the same emotional reaction a lot of people did in terms of crying. I was just kind of always getting pissed off and angry at things, you know. But I can say since I've been back, I do notice I'm a lot softer in a lot of ways, you know, where like now if I'm like watching like a kids movie with my kids, I start getting teary eyed, and that was never the case before. So I definitely think, you know, being in Gaza affected me in some ways. I just haven't been able to like put my finger on it yet, you know?
Thank you for sharing that.
Yeah, no problem.
And I did have a second question. I know you mentioned it's kind of hard to follow up with patients once they come in just because of like the chaos. Is there any system put in place to like, inshallah, one day when like everything's over, like to follow up, like a record or some sort to like follow up with patients?
You know, so I mean, we when we got there really wasn't. So before we got there, no, after I left, we sent a laptop for them because they needed a laptop just to keep track of patients, and I was just kind of surprised that they just didn't have that stuff, you know, already, you know. And I think a lot of it's just to do with it just things are destroyed, you know. But I definitely I think that's, you know, after I left and I was thinking about what can we do to go back and make things better, especially if the war's still going on. And that's something I've actually touched base with Humanity Auxilium about is, you know, we just need to set up these like field clinics, like just to be post-op clinics, you know. Even if we're not the primary people who did the surgery, just like let us take a look at your incision. You know, let us make sure you're not getting infected, things like that. Catch infections really early before they need to get, you know, be hospitalized. So I know those type of initiatives are there. But it's tricky because being out in the field is actually very dangerous there, you know. So starting a field clinic is not as, you know, it's not as easy as you think, you know. um, and then the hospitals are just too busy and too, you know, like consumed with acute trauma to be dealing with like chronic things and post-op care and things like that. So it's hard. I'm not sure what the right answer is, but I definitely think starting some type of like program where they're just like, you know, where they're just providing some type of post-op care, like, hey, you had surgery within the past month, come see us, you know, let us take a look at things, you know, is probably like the easiest place to start.
Thank you. Thank you.
No problem, man.
I wanted to interject for just a second. Normally during these talks, we take a moment to just like take a screenshot as a group photo.
Yeah.
If you don't mind, can we just pause that and then we can definitely open it back up for
Yeah.
questions. But if anyone wants to turn on their camera for the group photo, that would be great. And then Chanmi can take the screenshot.
Yeah, well, why don't, just in case people need to run to the bathroom or something real quick, can I ask a question first? Buy some time and then we go ahead and do that. Okay, so my question, Dr. Hamawi couldn't make it, and we know he's in the East Coast, but I was wondering if like you could talk about the interdisciplinary aspect of when you were in Gaza, like the other disciplines that you work with, if there's like plastic reconstruction or like any of the specialties, like how was it working with different specialties in that
Yeah.
context?
So, when I was there, we worked a lot with this plastic surgeon. And me and him interacted a lot together. He was a plastic surgeon who had a little interest in hand surgery, so we kind of coordinated care quite a bit. But in terms of like the interdisciplinary care, despite the chaos, I feel like the physicians and the teams were communicating very well with each other, which was amazing just given the circumstance. But you can imagine that, nobody there just has an orthopedic injury or just has like, it's not like here, like someone falls and breaks their wrist. Over there, it's like, okay, they got shot in the arm and it pierced their artery and they have a fracture and now they have this giant wound. So we need a vascular surgeon to repair the artery, orthopedic surgeon to fix the bone, and there's a big soft tissue defect, so they might need a skin, like a skin graft or like a flap. So there was a lot of that going on there. So like I said, it's amazing how well and how, despite the chaos, how well they were able to work together like that. And then on top of that, like a lot of these patients, they end up needing intensive care. So you're communicating daily with the ICU docs and things like that. Yeah, that was something I was actually pretty impressed with while I was there, just how well they were able to work together, despite having like no like EMR computer system. Everything was just like, I mean, if you needed a plastic surgeon, someone would be like, oh, I think I saw him like, an hour ago, like in the locker room, and someone go run and find him, and then 20 minutes later bring him back. So it was a lot of that. But they were able to do it, and they were able to work together, and like I said, providing the best care they could in that circumstance.
Thank you so much.
No problem.
Right. So if we can take a group photo, I think part of Dr. Khan's work is that he's advocating and being a speaker, and like I think us participating by taking a group photo so that he can also spread the word is also helpful. So if you guys can turn your cameras on real quick, that would be awesome. And then I'm gonna go ahead and take a screenshot, and I'll take a couple just in case people blink. So thank you. I saw so many different schools present today, like from different, like all over the country. So I was really excited. We have some undergrad students, we have some grad students. So, all right. Okay. Last minute. All right. I'm going to drag my mouse and everybody look at the camera, smile. 1, 2, 3.
Cheese.
One more just for good measure. 1, 2, 3. Awesome. Thank you. Let's reopen up for additional questions.
I wanted to ask about like the reality of physician burnout and kind of how like the medical team kept morale and even like motivation, or even any insight you had on how the doctors are still doing the work they do more than a year later.
And even a follow-up to that also, like when you come back to America, how do you motivate yourself to care for people when it's just such a different like environment and different needs?
Yeah. Sorry, I was just distracted a little bit. Can you repeat the first question again? I just hear my little son crying out there, so I got a little distracted, but
Sorry. I was wondering about the reality of physician burnout and kind of like how the team kept morale, and then also if you have insight on like how the local physicians are doing almost a year and a half later.
Yeah, no, I think burnout was a real big issue there. And I think that was one of the biggest benefits we provided, I think, to just being there. Like I said, skill wise, knowledge wise, like, they're amazing. We weren't bringing anything new to the table or any like, like it's not that I was better than them or smarter than them. If they just needed like a break, and we were able to provide that break. So, in terms of like how they kept their morale, I mean, the only thing I could attribute to is just like the faith of the people of Gaza. You know, they're a very devout group of people. You know, when you talk to them, I mean, they all, like, without question, have like zero doubt that they ultimately will win this war. You know, they ultimately they know victory is going to come. I think that's kind of like one of the biggest driving factors for them. But you know, they're all like you know, like I mentioned, none of them are getting paid. Um, you know, a lot of them have lost their homes. A lot of them are living in the hospitals, or they're scared to go home because they know that that might make their home a target. Um, you know, despite all that, I mean, you know, these guys, you know, in the middle of all this, you know, we're still making jokes, we're still laughing. I mean, you know, we still send each other like funny like memes on like WhatsApp and stuff like that, you know. Um, and You know, they're just a very strong group of people, and you know, when I talked to them about that, and I really tried to like kind of like you know, how did you guys become like who you are, you know? And one of them, you know, he mentioned something very interesting. He said, you know, prior to this war, you know, Gaza's been under siege, you know, like military siege, air, land, water, everything, basically cut off from the entire world. You can't leave, you can't, you know, no one could come in or out. Um, they felt like their neighbors, like Jordan, Egypt, kind of turned their backs on them, you know. So they kind of just were like, you know, we only rely on ourselves and God. And I think, you know, living like that for years and even a whole decade just kind of prepared them for that war, for, you know, this current war, in the sense that they are relying on themselves and they have strong faith in God. And that's kind of what keeps them going, you know. I will also, and I love mentioning this because I just it even like gives me goosebumps, but you know, the when those college protests were like really at their, like, you know, getting really, you know, um, at their height, like I was getting like text from people in Gaza, like showing me, like they're sending me pictures of like the protests, like, you know, in New York, at Columbia, here in California. They even sent me a picture of one from like UC Irvine, and they were just like so happy to see that people were protesting on their behalf here. So I think even little things like that, you know, like it just gives them that little like glimmer of hope, you know, that I think that's what kind of keeps them going, you know. So I think they deep down know like the world is on their side. It's just the government, some of the governments aren't. So you know, yeah, it keeps them going.
There was a second part for Phoebe's question where she said, like, coming back here to the US, like, how do you keep going, I guess, in that same way? Like, how do you go to a patient who is here and, or in, you know, in California of all places, and just say, like, oh, wow, like, you know, a year ago I was working on a completely different patient. So how do you like reconcile that?
Yeah, that was actually that was it was funny in some ways. You know, when I got back, when I first got back, I thought I was going to be like interrogated, but nothing happened, which was interesting. But when I went back to work, you know, you really start to kind of like put things into perspective when, you know, you were treating like an 8-year-old girl who like whose arm was blown off, and then like someone comes to you, you know, so I'm in Southern California, I'm in Orange County, you know, so I mean, you know, take that as you will, but like, you know, people come to me and be like, you know, my finger like doesn't straighten out all the way. It's like down like that, you know? And it's like, you know, when they're sitting there and I'm just sitting there like, oh my God, like really? Like you went to your primary care doctor, you got a referral to see me, and you actually came to my clinic to tell me that you can't fully straighten out your finger all the way, or it hurts, you know, like little things like that. It kind of puts things into perspective. Um, you know, healthcare in the US, especially California, it can be very like demoralizing sometimes. um, you know, you see patients who like expect perfection, or they're just pissed off about something, or they get angry because they waited 20 minutes to see you, and then just, you know, after going there, you just come back and you're just like, man, like, you know, those patients, like I cut off this person's like finger, but he was so grateful to me, you know, just the fact that I was there to take care of him, you know. So but I think I needed that, you know, because I was getting burnt out here, you know, like because I was just getting annoyed of, like, you know, you can imagine like we always kind of joke around hand surgeries, like, you know, the hand patients are always like the weirdest, you know, like they just come in like with weird complaints and stuff like that, you know. Like I swear to you, I had a patient who told me he would look at his finger under a magnifying glass and his skin didn't look smooth, and I was just like, okay, you know, like this is America, you know. But I really needed to go to Gaza because I think that really put things back into perspective for me about why I did this, and like what why I chose this as a career. And it just kind of gives me, there's times where I was talking about like cutting back on medicine and pursuing other things on the side, but after coming back, I'm just like, no, I'm going to go back to Gaza, and I need to perfect my skills here, get better at stuff, so when I go back there, I could provide better care for people over there too.
And then somebody else asked a question. Actually, if you want, Isaiah, you can ask the question. I was going to ask for you.
Oh yeah, okay. Thank you so much. Assalamu alaikum. Thank you so much for coming out and sharing your experience. I was just wondering, as like for people who might be interested in traveling to Gaza, in order to kind of do the work similarly to what you're doing, something that they teach us in like the protests and rallies is how to like keep each other safe. So I was just wondering if you faced any encounters with any like political forces. You might have touched on this already, and then how did you and your colleagues like manage to keep each other safe, and including your patients, if you don't mind?
Yeah, no, not at all. So, I mean, we were fortunate in the sense that, like on my trip, I did not run into a single Israeli, like no IDF, nothing like that. And that was because Egypt controlled the border. So, we dealt with the Egyptians, we got into the Palestinians, and while we were there, we didn't have to deal with soldiers or anything like that, So, that doesn't mean we felt safe, like after that whole World Health Kitchen thing, there definitely was this kind of like aura, like, oh, wow, we're not as safe as we thought. Um, but we basically, you know, I think if anything, we probably made things safer for them. Like I mentioned that, being a U.S. citizen at the hospital probably keeps that hospital a little safer from the Israelis for a little bit. But while we were there, we were just kind of, before we went, the WHO in Cairo had a meeting with us about how to stay safe. And a lot of it was just like, everything we do is coordinated with the Israelis. They know where you are. Like, so don't go off the path, don't, as much as we wanted to go to the mosque to pray Tarawih, they're like, don't do that, cause you're a new face. If a new face shows up in a location and there's, cameras or drones or something like that, like you don't know what your presence might do to that location, especially because they don't know who you are. So it was always like for us, your job is here to provide care. Like, don't go to the markets, don't leave the hospital. So for 2 weeks, we basically did not leave the hospital. We just stayed there because that was like the safe and right thing to do. um, Aside from that, like I said, there was really not much you can do in terms of guaranteeing your safety. um, Fortunately, I don't think any like U.S. healthcare person has been hurt so far there. But I mean, I wouldn't put it past the Israelis to do something like that in the future. Hope that answered your question. Yeah.
I had a question. So I know you mentioned like you went on medical missions kind of before in your training, and then leaving your clinic. I know you said you didn't really get interrogated when you came back, but when you were leaving, did you experience any type of pushback, or like were they kind of trying to restrict what you were saying or what you were wearing in clinic, or if you wanted to leave for the medical mission, did they push back on that in any way?
Oh, you mean before I left, or?
Yeah, like did they have any feelings about that?
No, like one of my partners, Dr. Tiffs, she's a pediatric orthopedic surgeon. Like when she found out I was going, she like came over and like gave me a big hug, and I wasn't expecting that. And then she told me, she's like, my best friend was actually in Gaza on October 7th doing surgery, and she had to be evacuated. So I lo and behold, I found out she was like this big pro-Palestinian supporter. Um, some of the people I kind of thought that might say something, but they all were like, very supportive actually. So I didn't get much pushback in terms of going. When I came back, I had a couple patients who were actually very happy to hear that I went. One guy actually, like, he could have seen a local hand surgeon, but he drove an hour and a half to see me, and that's just because I went to Gaza. But I didn't see this guy, but he saw my PA. But I had one patient who told my PA, "Tell Dr. Khan there's two sides to every story," and I was like, okay, whatever. But for the most part, everything's been very, very positive. People were like, even people that were, like when October 7th happened, and they were kind of talking to me about it, and they kind of were pushing back on things I was saying. They were actually like, "Oh, we're really proud of you for going," things like that. So But yeah, it's, when we came back, I really thought like TSA or someone was going to pull me aside and ask me a bunch of questions, but I got none of that. Even on the way to Gaza, we the friend I went with, I was kind of like, hey, don't tell anybody if they don't ask where we're going. But my friend was like, everybody, we're going to Gaza, we're going to Gaza, we're going to Gaza, And I mean, most people were actually responding very positively, Even border control, like they pulled us aside because we had a lot of cash. We snuck in a lot of cash, but we're not really snuck in, but we declared it. But we felt like drug dealers because we had a lot of money on us. But when they were going through our stuff and we showed them the money, and they're like, what are you going to do with this? We're like, we're taking it to Gaza, and they both were like, that's really cool. And I was like, okay, yeah. So I was like, that's why I really, really believe majority of people are on the right side of this. It's just, with media coverage and politics, you just don't see that, you think it's the opposite,
Yeah, that's really cool. Thank you.
From.
I have another question for those of us on the call that are interested in working in war zones and humanitarian aid in the future. Can you kind of walk through what you did during your training, like in medical school and in residency, that really helped you get to this place, and like what maybe you would have done differently?
I think, during residency, especially after my first trip at PCRF, it was kind of a little different experience. So PCRF, when we went to the West Bank, they were doing a lot of like elective stuff and congenital stuff. So we were doing a lot of tendon transfers and things like that. So after that trip, I was all about that. So I was going out of my way to do those type of cases. And, I still love doing those type of cases. But, Gaza was very different because it was a much heavier trauma experience, and I can be honest in saying, like, during residency, I wasn't that interested in trauma, in orthopedic trauma, just because those cases were always the ones going like in the middle of the night, or they were like, like really long, big pelvis fracture cases, So, but I do think in that setting, especially war conflict zones, like learning and being comfortable with trauma is an absolute must. Um, and even though you're not going to see that the same level, I think you're gonna, with the right training and the right mindset, and just making sure you get tons of experience, tons of cases, tons of volume with those type of cases. You just develop, like, the right skill set and the comfort with, like, okay, I might not have done this specific case, but I've done enough of these similar cases to feel comfortable treating this crazy explosive pelvic injury, so doing trauma, unless you have a very specific thing you want to do, like, like the hand surgeon I went to Ramallah, his whole thing was like, I want to go to Palestine and I'm going to do congenital deformities. That's all he was going to do. So he didn't go to Gaza for war, for war care, conflict care, anything like that. But if your goal and your objective is to be able to go, but not even just go, but also be very, very like needed. I think the more trauma you can get under your belt, the better.
I have a question. I know that we're kind of ending, like we're meeting the deadline that we had initially put up, but I heard that you're willing to stay and answer more questions. So feel free to log out if you need to and stick around if you have more questions. Our hard deadline is 8 though. We want to respect Dr. Khan's time. My question is more about like the ethics of war medicine. Can you talk a little bit about like how you ethically navigate treating both civilians and combatants or people like involved in the war, and how do you remain neutral? Is neutrality a thing? Like, just like anything you have to say about that.
Yeah. I mean, I definitely think you have to remain neutral. To my knowledge, I don't think I treated a combatant. Like I said, majority of my patients were like under 16. Had that situation arise, I think you just have to be neutral. Over there, you definitely don't ask questions like that. One, because they just don't really know who I am. Um, so and I think realistically, I think a lot of those guys are probably getting care somewhere else, but yeah, I think in that situation, I mean, we've in medicine, you kind of, you take that oath. So, I mean, I think the right thing to do is to be someone like, especially if you want to be a physician, if you want to be a good physician, and just a good human being is like, we should be willing to take care of, like, even if I was in Gaza and there was like an injured, like, IDF soldier, I think sometimes the right thing to do is still take care of them. I think you need to be, neutral on those things. You take care of them. And then, hope that that they do, receive their justice somewhere down the road, that they're, charged with war crimes or whatever, but at the end of the day, we're there to help people. Um, there's, a lot of the decisions we were making, I don't know if they necessarily fall under ethical decisions, but, like it kind of just comes down to choosing the right treatment for people. So like kind of alluded to before, where some cases we would try to fix this if it was in America, but over there, we're going to have to kind of make that hard decision to just amputate. Like I said, we had to make that decision a lot. And that was hard, because you can always thought in the back of your head, like, man, like, this is not what I would be doing if I was in the US right now. We would be fixing this finger, and repairing the nerve. But here, we're a different situation. We have a different circumstance. And the patient might not understand this right now, but even though we're doing amputation, it is the right thing for this patient at this time, because we're trying to do the quickest one and done, minimize risk of infection, minimize need for future care. And ultimately, like, in that situation, that's the best thing for the patient.
And kind of following up on that, like, who decides where resources get allocated to? Is that a discussion amongst the providers? How do you prioritize which patients get which treatments?
To be honest, it was just a discussion amongst us, but I can tell you that I don't feel like we were ever really having that. When someone needed care, we basically were using whatever we had to take care of them, especially when it was like, life-saving treatment. When it came to like limb salvage and limb saving, I think a lot of times no one's really verbalizing like, like, we can't save this arm because we need to save this plate for someone else. But that kind of, I wouldn't say that's kind of how we were approaching things. We were always approaching things from the sense of, like, what's the quickest one and done. Like, we don't have room for, we don't have a post-op clinic. We can't keep this guy in the hospital for too long. We need this bed. We need this room. We need this OR. What's the quickest one and done for these guys? So, that the discussion was sometimes had, but a lot of times, like, everyone just kind of knew, like, what we had to do.
I got another question for you.
Yeah, what's up?
So I know being in Gaza can be difficult, and we've talked about a lot of like the negatives, but and like the hardships. But what is like the most inspiring moment you had in Gaza?
Most inspiring moment. I wouldn't even say it was like one specific moment, but it was kind of just I alluded to being there the last 10 nights. So just working all day with these guys, and then the entire night standing in prayer. Despite everything that was going on, just kind of made me realize, like, man, like these, just kind of go back to, these guys are special people. I want to be like them, and there definitely was a moment where we were praying the night prayer, and we had Sheikh Abdullah reciting, and he had a beautiful voice, but like, you could hear the drones, like outside. You could hear explosions in the background, and then you could hear a patient screaming in the hallway. So it's like all these sounds while we're sitting there, like, praying and listening. It just kind of, like, I was just like, man, this is so real. This is like such a real feeling right now. Um, and Yeah, so it wasn't one particular moment. It was kind of like everything together with these people. And it always comes back to them. Like Gaza's is a special place because of the Gazans. Because of the people there. And like those memories I have with them, and the conversations we had sitting around with them, and just all the same thing, just like praying with them, like lifelong memories.
Thank you.
Yeah, no problem, man.
I know you mentioned most of your patients were children, but I was wondering like your interactions with the families and kind of how, if you could just speak on like the effect on families in a crisis like this.
Yeah, no, so that's the thing. I mean, like it was so chaotic. Like I can tell you that I probably spoke with one family while I was there. So everybody else, we retreated, got triaged, and then basically sent to the hospital floor, you know. And then I would like have no idea, you know, what happened to them or where they went, you know. There was one family that you know that they kind of went out of their way to come find me and talk to me and things like that, you know. But for the most part, you know, I don't I attribute it all to just the chaos and the hecticness, you know, because you'd hear an explosion and then you know 15 minutes later there's gonna be a whole bunch of people coming to the ER, you know, and sometimes they're coming with family members, sometimes they're coming with neighbors. Um, Everything just gets lost in the ER, and then they'll get sent up to the OR, and then you do the surgery, you stabilize them, and then the nurse and the post-op team take them out, and then you really have no idea what happens after that, you know, unless they have a complication or something like that. But yeah, like the interaction with the family was very, very minimal, and I just attribute that to like just how crazy and busy everything was, you know.
I had another quick question.
Yeah,
How is like access to the outside world, like news or even like communication with your own family? Like what level of access did you have?
we, you know, the hospital did have some Wi-Fi, but they were keeping it. They basically would close it, like restrict us and basically people from it, so the hospital can use it because they had, you know, they were running on generators and you know they only had a certain amount of data per day that they could use. So, but you know, we would find like the guy who runs like the servers and stuff, and like, can you give us like an hour? And he'd give us like Wi-Fi access for like an hour, and then I can call family or text them, just update them, let them know everything's okay, you know. So it was limited, but it was possible to do that, you know. So
I have another question. I'm
yeah,
so sorry.
no, it's all good.
Um, so I guess I worked as a trauma technician on the south side of Chicago before, and like it's gotten pretty busy there. And I know in my experiences, like sometimes you just nonstop at one patient after the other, and it's you like don't necessarily have the time to like I guess humanize the situation, if you will.
Yeah.
Like it's just like, oh, move on to the next one, move on to the next one, move on to the next one. Is that how it kind of like is when you're volunteering and like working in Gaza? Like, is it that busy? Like, is there any downtime at all, or how does that work out?
There definitely was downtime, you know, because a lot of these things would come in waves, you know. And you know, fortunately for me, like I was in the OR, so you know, things were coming to me like one or two at a time. So I felt like I was able to kind of humanize them and kind of like, you know, um, really like look at them as my patient. Whereas I know the guys in the ER, you know, they had that experience, you know, like it was just overwhelming at sometimes. Um, you know, this patient's on the floor over there, that patient's like in a bed, and you just had kind of had patients everywhere, you know. So um, in that perspective, I had a little different experience than the rest of my team. That's just because I was basically just in the OR all day, and just one case after another, you know. So you said you worked in Chicago?
Yeah, I used to work in Chicago.
Are you Palestinian? Or
I am Palestinian.
I know they have the big Palestinian population out there. Yeah.
We sure do.
Yeah.
All right, so I know it's getting late and you have some place, I'm sure you have some places to be. So we'll wrap up with some final words, but I think Shelly has one last question, and then if you can give us kind of some final wisdom. But Shelly, go ahead.
I was just curious if you know of any like research needs that the attendings there could use help with, because we have such ample access to databases and AI and internet and things like that. Are there things that we could do here to just resource like how to keep flies away or other things like that that
I definitely think there's probably need for that. You know, one of the doctors, and his name is slipping my mind right now. He's actually is very interested just collecting the data from everything they're seeing. He wants to put together research projects on what they've been seeing during the genocide. So in terms of what they need, I mean, in the beginning he's just like, hey, I need a computer. So we had to get him a laptop just so he can use Excel and put together data. So I mean, I think they need things. They need even the most basic things. But I can tell you right now that even with that interest in mind, I just don't think they have to do that right now. So he's trying his best to collect some data, some data. But even he was saying this is all secondary. This is stuff I'm going to look at afterwards. Right now, it's just I got to treat my people. But I definitely think that's going to be something that we have to help them with. It's going to be hard to figure out because one, the limited data access they have with the Wi-Fi. That whole hospital had one laptop. So. Yeah, but I can I could definitely reach out to him and see if there's anything specific he needs, and then I don't know if you can get my information from these guys and we can kind of touch base on that.
Yeah, that sounds perfect. And Yahya actually asked in the chat if you're willing to share your email with the group, and
Absolutely.
yeah, we can definitely reach out. Do you have any final kind of last wisdom to leave us with as we continue on in our education and training?
Yeah, one thing I always love to end with is that, and this was actually a conversation we had with this girl who's 7 or 8 years old, and she was a patient at the hospital, and she wasn't just speaking to Muslims, she was kind of speaking to the world, and she literally was tell everybody that this is not just our war, this is your war. She's like, we're just front lines, so, and basically just saying everybody has something they can do, some way they can contribute, whether it's just telling people about the situation or trying to educate people, or if you have the opportunities like me to actually be able to go there. But I just loved how she worded that. She said this is not, don't just think of this as some situation over there and we're over here. This is not just a Palestinian issue or a Muslim issue. This is a humanity issue. And this is something that people are going to read about in the future and be like, how did this happen? How did people let this happen? So we need to look at it that way and just remember that this is not just the Palestinian, the people of Gaza, their war. This is a war on humanity, and we need to look at it that way. We have to find our way to fight on their behalf as well.
Thank you so much. I know personally I'm more inspired than I was before to keep going and hopefully, join you on another mission similar to the one that you did in the past. And I really appreciate you kind of taking on the role of Dr. Hamawi and yourself. So really appreciate that. And I'm sure everyone here, thank you for coming, and I hope you guys enjoyed it as much as I did and took something from it. And yeah, if there's nothing else, we can wrap up. And thank you so much, Dr. Khan. I'm so impressed and I'm so glad that you were able to make it and to hear your story.
Alhamdulillah. Thank you so much. I
Thank
appreciate
you.
it. Yeah, and I always love talking about this stuff. So you can come in. I'm always happy to talk about Gaza and stuff. So
Thank you so much. I'm gonna just pull up a slide for our link tree. You can scan the QR code to get updates about the future GSA conference coming up. Again, the conference has a lot of amazing doctors who have also done missions in Gaza, and then there's also a panel with patients from Gaza. So I'd really encourage everyone to check it out. And then if everyone else is good, we're gonna go ahead and close up. Thank you.
thank you.
Thank you.
Bye.
Thank you.
Thank you.
Thank you guys.